All right, everyone, we're going to go ahead and get started. Thank you so much for joining this webinar today. We're going to cover how cities can improve health outcomes using congressional district level data. This is a webinar with the National League of Cities and New York's University. My name is Annie Osborne, and I am a program director of strategic partnerships for the National League of Cities. So we are really excited to partner with New York University and their health dashboard team on this event. They have been a critical partner with NLC for a few years now, and they have provided cities with data about metrics that impact health holistically, such as education levels, medical indicators, broadband access, credit insecurity, air pollution, and much more. They're now expanding that data from the city level to cover congressional districts as well, which will be key as cities approach health regionally and advocate for better health support at the federal level. So during the webinar, the dashboard team will showcase how to use the tool in the dashboard. There'll be plenty of time for Q&A at the end as well. It's just a couple housekeeping items. The event is being recorded, and the recording and slides will be shared with all registrants afterwards. Please use the Zoom chat box to ask questions throughout, and we will do our best to answer them at the end. If we aren't able to answer them, we will definitely follow up with you afterwards. Please also keep yourself on mute throughout the presentation unless you're asking a question. But with that, I'm now going to turn it over to Samantha Breslin, who is the program supervisor at New York University, and she's going to lead us through the presentation today. Thanks so much.
Thank you so much, Annie, and thank you everyone for joining us today. It's a very beautiful sunny day here in New York City. So if you're joining us, on the East Coast and it's nice and you're taking time out of your afternoon to be with us on Zoom, we appreciate you. And I'm really excited to share this new tool with you called the Congressional District Health Dashboard. I'm just going to launch into full screen mode. So like Annie mentioned, the Congressional District Health Dashboard launched just earlier this year in January. Even though we provide all of our data that you'll learn more about in just a few moments at the district level, it is really relevant for city leaders and folks in cities to be able to see data broken out this way, especially those who do any sort of federal advocacy with electeds in Washington, people who are kind of allocating federal resources or trying to access federal grant opportunities. This data is really, we think, can be really helpful for people in cities, as well as just people who work more so in the kind of federal space. And so, what was the challenge that we were hoping to solve? Well, until we launched in January, there really wasn't any, rigorously collected nonpartisan data on health and the social drivers of health. So those social determinants of health that Annie mentioned earlier in the presentation, those just haven't been widely available or accessible at a grand scale at the district level. And so our goal with the tool is to provide that data and provide that granular data, and make sure that it's straightforward, it's unbiased, in order to help our users, regardless of their political affiliation, regardless of where they live, the size of their community, to be able to inform and catalyze priority setting. And so we know at the dashboard that data is really powerful, but we also know that data on its own can't change policy, but it is an important ingredient and is an important first step when we're hoping to do that policy change. And so data can help us illuminate challenges and assets in communities that maybe were hidden, or maybe we knew about them anecdotally, but we need hard evidence to be able to advocate for resources. Data can help us inform effective policy solutions. And finally, data is really helpful in being used to hold our leaders accountable and making sure that the people that we elect to office are really living up to their commitments and their responsibility. And who is the audience that we're trying to target with this tool? So when we were developing the Congressional District Health Dashboard, we were really building on our experience developing, managing, and leading the City Health Dashboard, which is our sister site, which provides much of the same data that the Congressional District Health Dashboard does, but instead of doing it at the district level, we provide that data at the city and the neighborhood level. And so that was a site that we had been kind of operating for the last 5 years. And so we wanted to use our expertise in that and apply it to this new site. And so we have a broad audience for the City Health Dashboard, and that has really been a strength of ours. And so for this site or this tool, our main audience is, elected officials and their staff, advocacy groups, journalists, researchers, the media, but also it was important for us to be able to connect with constituents or just normal everyday Americans who wanted to learn more about health, well-being, opportunity in their community. And part of the our ethos in having a large audience is that we want our tool to be as easy to use as possible for any sort of user, regardless of where they are in their data journey, regardless of their expertise level. We wanted them to find value in our site. And so the site is, you can access it at congressionaldistricthealthdashboard.org. I know it's a bit of a mouthful, but we were developed, like I said, in January, or we launched in January of this year, but we were developed in partnership with the Robert Wood Johnson Foundation, as well as our bridging partners, the Bipartisan Policy Center and the Center on Budget and Policy Priorities. And our team sits within the Department of Population Health at NYU Grossman School of Medicine. So, we are an academic institution, so it was really important for us to get that federal advocacy input and insights that we get or that we receive from organizations like BPC and CBPP, as well as our NLC partners. And this slide, there's a lot on here, but this slide shows all of the metrics or all of the things that we measure on the dashboard. We have 36 measures, like I said, of health and the social drivers of health that are spread over these 5 domains that you see on this slide. So health outcomes, so things like diabetes, firearm suicides, obesity, social and economic factors like broadband connection, poverty. We have measures related to health behaviors or the physical environment, and finally, measures that are kind of categorized as clinical care measures. So things like uninsurance rates or routine checkups. And all of our data are drawn from federal data sets that really adhere to the most rigorous standards of data collection. So these are data sets that come from the US Census, the CDC, the EPA, and our team at NYU, analyzes these data to the congressional district level. And sorry, I do want to just mention before I move on to the demo that all of the measures that have an asterisk next to them are measures that also have demographic data available as well. So data either broken out by race, ethnicity, sex, or age, where that data is available. And so with that, I will pivot to the site demo. And so, like I said before, we're accessible just at congressionaldistricthealthdashboard.org. Our site is totally free to anyone who has a broadband connection. And as long as you have, a smartphone or a tablet or a desktop or a laptop, whatever it is, you're able to access all of the information that we provide on our site. So and apologies for me not looking at the camera, but I am just going to start. So we have this main menu and this navigation bar, which is really how you're able to access a lot of the features that we provide on our site. So always, if you're kind of unsure of where you are, you can always come back to this navigation bar. So I'm going to start with metric maps. And when you click on metric maps, you're taken to this metric selector, which has all of those same metrics that I just listed on the previous slide. And I am going to look at rent burden today. And so what's great about the dashboard is that once you get oriented to one aspect of the site or one metric, and you kind of get acquainted with the symbols that we use or the data visualizations that we use, you really know, how the sauce is made for the rest of our site. All of these visualizations are all standard and consistent across all places and across all metrics. So first, I just want to, draw your attention to this scale bar here, which represents the range of values for a particular metric. And across all of our metrics, lighter colors indicate better outcomes and darker colors indicate poorer outcomes. And you'll see this little statement here that kind of indicates the direction of better outcomes. So for example, with rent burden, you want less of your households experiencing rent burden or paying more than 30% of their incomes on rent. So the lower values will be where the lighter colors are. But for a measure like walkability, you want more of your neighborhoods or more of your communities being walkable. So that statement would be on this like high end of the scale. And then we also have, you can see quite clearly the US average. So 46.9% of households in the US are experiencing high rent burden. And we have this sense-making statement up here, which is essentially just translating all of the information or all of the numbers on this scale bar into layman's sentence format. So we want to be able, like I said before, to reach people where they're at in terms of how they consume information. Perhaps they're better at reading reading about data in sentence format. Some people might be better at looking at the data visualization. So we want to be able to really reach people regardless of how they consume information. And on the side of the left side of the map, you can see more about the metric, how we measure it, the year of collection, the data collection. And then scrolling down, you can see this national map, which shows us, how all 435 congressional districts in the US are performing for rent burden in this case, but really any metric that you're looking at. So at a quick glance, you're really able to see trends that pop up at that national level across the US. So as we would expect, red, and like I said, darker colors mean poorer outcomes, lighter colors mean better outcomes. And so like we'd expect, given that we're looking at rent burden, we're seeing some pockets of dark purple on the coasts, and we're seeing lighter purple or lighter colors, in the Midwest. But unlike what we might expect, I'm seeing darker purples in pockets that I might not have expected. So like what's going on in Colorado or in Louisiana here. And then you can also each district, you're able to click into it to get more information about what district it is, as well as the estimate. And you can click into the district to get more information and see that district kind of blown up. And you're also able to zoom. I'm just going to zoom into Florida and see just like the range of values in Florida. We have some really, really dark purple. So, in Florida 20, over 64% of households in this district are paying more than 30% of their incomes on rent. So that's a lot of their income, or that's a lot of those households. A majority of the households there are paying more or are rent burden. And so you're really able to see, how districts within a state compare to each other. And so I now want to just draw your attention to a different metric. Uninsured has been on my mind, just given that we're, the public health emergency related to COVID is winding down in May. We have continuous enrollment having ended earlier in March. So uninsurance is definitely on my mind. And I wanted to maybe see, what was happening nationally in terms of uninsurance and the landscape that districts and states will find themselves in as, all of these things keep unraveling. And so like we saw with rent burden, we're seeing some clear patterns, really low rates of uninsurance in the Northeast and the upper Midwest. and some dark pockets or some high uninsurance pockets in this southern corridor from Texas through like North Carolina and Florida. And so I want to see, I'm seeing some variation here in Oklahoma. So I can either zoom into Oklahoma like we did with Florida, or I can type in Oklahoma here, or the district that we want to look at. Sorry if I can just spell correctly. So I can type in Oklahoma, and now we're seeing Oklahoma's all of the districts in Oklahoma and how they're comparing or how they're performing for uninsurance. So like I said, we have those same scale bar and same sense making statement, but instead of seeing the US average, we're seeing that Oklahoma has around 17% of their adults who were uninsured in 2020. And that's compared to the 10% that we have, or that we've kind of measured for the US average. And you can see how the different districts within Oklahoma compare to each other. Again, we're able to click into all of these different districts, but let's click into the Oklahoma second, which seems to have the highest rate of uninsurance at 21.6%. So as we keep, we started out at that national view and we keep kind of drilling down into more granular, more local geographies. And so now we can zoom into Oklahoma 2. And again, that same sense making statement and scale bar, but now we're looking at Oklahoma second. And I do want to draw your attention before moving on to, so the default comparison will always be the US average. So 21.6% of Oklahoma second adults do not have health insurance access compared to the 10% of the US, but perhaps you want to compare yourself to your state, or perhaps, you are, you work in the public health department of a city that is in the Oklahoma second district, and you want to advocate for more resources coming towards the second versus the third district. And you have to do that with your, maybe some state electeds. And so you can do that by just, we have the ability to change our comparison to the state average, in this case, Oklahoma. So by clicking that drop down and changing to the Oklahoma average, we're now seeing the scale bar that shows us how Oklahoma second compares to the Oklahoma average of 16.6%. And lastly, in terms of the demo, or not second to lastly, actually, I do want to just draw your attention to the demographic breakdown for this metric. So like I said, quite a few of our metrics are available. We have that data available disaggregated by race, ethnicity, sex, or age when that data is available from our data source. And so you can see that by the metrics by demographics tab. And so for uninsurance, we actually have all three of those breakdowns available. So you can see, that males in this district are more likely than females to be uninsured. And, there's about 26% of the Hispanic residents in this district who are experiencing uninsurance compared to 15.6% of Asians. So this information just it just provides a different lens to look at these challenges that's not just geographic. It allows you to apply a deeper equity lens and understand the different constituents that you serve or the residents that you serve and what challenges they may be facing. And then finally, I want to just show you what we have called the district snapshot. And you can access the district snapshot from two places. So either from the Congressional District Health Dashboard homepage right here by typing in your district, or you can access it here again by typing in the district. So I will just type in New York 7 because that is the district where I live. So I'll type in the District 7 or New York's District 7, and we're taken to this snapshot of the district. And the snapshot has two different facets to it, or two different tabs, or two different sorts of information that you can access. I'm only going to go over the metrics overview, but we do have this district facts tab, which has a breakdown a demographic breakdown of each district. So what percentage of the district is, age 16 to 64? What percentage of the district is Black versus white versus Hispanic? There's also information related to elected officials in this district facts tab. But this metrics overview tab, I just want to show you, is really helpful in getting like a quick 3,000 foot high level overview of how your district is performing across all of our measures. So all of our measures that I kind of have shown you in those metrics selector or that slide in the PowerPoint, all of those metrics are listed here, but instead they're listed in alphabetical order. And you can see at a glance how each what the New York or what the district estimate is for that metric, but also a comparison to the US average. So we use symbols that are pretty well known, red, yellow, green, red being that the district is performing worse than the US average, yellow triangle meaning that the district is performing around the US average, and the green circle means that the district is performing better than the US average. So looking at binge drinking here, 19.3% of New York 7's adults reported binge drinking in the past 30 days. And that's around the US average for that metric. And if you hover over this statement, you can see that the US average, for example, here is 17.9%. And you're able to access the metric maps that I just showed you previously just by clicking on the metric name. All of these metric names are hyperlinked. And you can hover over this tooltip to see more information about the source that the data comes from, as well as the years of collection. And so finally, I just want to move back to the PowerPoint. If I can go back into full screen mode, just to share some use cases and some examples of how you can use or really put this data into action in your community, or how leaders in your city can put this data into action. And so, the data is really helpful in terms of, or for those folks who regularly advocate or communicate with their elected officials. You can use this data or this information to advocate for grant funds or federal programming to be targeted towards districts that you work in, or districts that have the highest, uninsured rates or the highest child poverty rates. I recently, just last month, I attended the NLC's Congressional Cities Conference, and a lot of folks that, I heard from or spoke to were, really trying to leverage all of the resources that are available from the federal government in terms of policies or programs or funding that's available to cities. And so this information is really helpful for kind of demonstrating that need and helping make the case for those grant funds or for that program implementation. You can also use these data to show your lawmakers how your district or your state compares to other districts in your state or other districts in the country. And then finally, this is more high level, but this tool is really useful for helping our members of Congress better prioritize health needs. As city leaders, you are working much more closely on the ground with local communities. And so you have a better sense or a better pulse on the challenges that your constituents are facing. And so sometimes we need to make sure that we kind of get that on the radar of our federal elected officials. And so this tool can be really helpful in getting that priority setting or helping you kind of prioritize or work with your elected officials to prioritize health and to prioritize the health of your constituents. And then finally, before Q&A, I wanted to just make some direct connections to the City Health Dashboard, which like I said before, is our sister site. So that site is available or is accessible from cityhealthdashboard.com. It's free. As long as you have an internet connection, you're able to access that site. And so the City Health Dashboard provides much of the same data that this Congressional District Health Dashboard does, but we do it for 900 US cities and the neighborhoods within those cities. So any city that has a population of 50,000 or larger is covered on that tool. And why am I trying to make the connection between these two sites? Well, while the information is somewhat similar, each site is unique in the context that it provides you that information. So the Congressional District Health Dashboard, of course, provides that data broken out by districts, but sometimes it's important when we are advocating for resources or funds or policy that we want to also demonstrate what need looks like on a more local level or at a city municipal level. So, using these tools together to just understand regionally what's happening, but also drilling down when you need to into that local context. And then just a primer, I'm not sure, how many of you on this call are familiar with the City Health Dashboard, so apologies if you already know about this tool, but much like the Congressional District Health Dashboard is really useful for kind of digging into trends, either nationally or at a statewide, the City Health Dashboard is really powerful in doing that same sort of comparison work at the city level. So you're able to compare health gaps across neighborhoods in a city. And, I've just flagged or drawn out, 3 neighborhoods in Columbus, Ohio. We're looking at life expectancy here. And these 3 neighborhoods are less than a mile apart, but residents living in these neighborhoods have very, very, very different life expectancies that range from 60 to 80 to 68. So this tool is helpful in identifying not only where those gaps exist, but just priming you to think a little bit more deeper about what could be causing those gaps. What is happening in these communities that is either helping or hurting the life expectancy in this specific example. You can also use the City Health Dashboard to compare your city to cities in other regions or cities with similar population sizes or demographic makeups. And then finally, use the City Health Dashboard to help you set priorities and better target your resources. It's really helpful for allocating, where we're going to spend our energy, what communities we should be outreaching towards, all of that stuff, which makes us, more effective public servants. And so with that, I will stop sharing and I will go to the Q&A to see if anyone has asked questions. I'm not seeing any questions in the chat. Let me go to the Q&A. But that is the end of the formal presentation. So feel free to drop any questions in the chat.
Can I ask a question while people are thinking?
Yes.
And I see we just have one question here. Is the backend data free to download? So I'll let you answer that first, and then I will ask my question.
Great. That is an amazing question, Anita. Yes, I can actually reshare, or we'll drop in the link to the URL, but all of our data is available for download for free from the Congressional District Health Dashboard website. We have CSV files so that you can either download the full data set for all 435 districts, or you can download by state. And additionally, for our City Health Dashboard site, we also provide all of the data available, or provide all of the data for free by CSV, but we also provide it through an API as well if you're a more experienced data user. So we can drop that link in the chat. Great question. And yes, we can email this presentation after the call.
The question I was going to ask was about how do you determine what metrics you include in both versions of the dashboard?
Yeah, so that's a great question, Annie, and one that we think a lot about, and we continuously think about, okay, are the measures that we are presenting, do they still resonate? Are they still meaningful? And so the first thing that we wanted to do is present a pretty broad 360-degree view of not only health, but also those social drivers of health. The people on this call know, we've kind of heard it said so many times at this point, but really the pandemic showed us that, health is a lot more than just, your DNA or your genetic code. It's more than what happens with your doctor, but it's actually not even more than just what happens with your doctor. It's the majority of your health is actually dictated by where you live. And so we wanted to be able to show, just, show in one place those social drivers or those social determinants of health, and really put health and the social drivers on the same playing field or on the same level. So people are more easily able to make the connections between broadband and health, or poverty and diabetes rates, whatever it is. And then the next thing that was important to us in terms of choosing our measures is that we wanted our users to be able to move the needle on the measures that we presented. So for example, on our City Health Dashboard site, we didn't want to present a measure just for this, or really for both of the sites, but we don't want to just present a measure for the sake of presenting it. That, to do that, it becomes quite overwhelming for our users. It's kind of like data overload or information overload. But more so than that, we didn't want to present something that a city leader couldn't move the needle on, where there wasn't that municipal level of change that happened. So for example, if a city could not do anything about improving broadband access, we didn't want to provide broadband access to our user. So that all of those different things has allowed us to create this more curated, but still pretty comprehensive look at health and the social drivers of health.
Thank you. One other question in the chat: does the CSV data include spatial or location data that could be used with GIS software?
Yes, so our data, and so I am not a data analyst, but I know enough about those data sets to tell you that all of the location data that you would need for GIS software is in those files. We use FIPS codes and all of that sort of information. I also want to just draw your attention just along the same lines as that question, is that on that data access page, we also have a really large, very comprehensive technical document which outlines and really goes into detail all of the analytic decisions we made, helps you, we have a code book that helps you kind of translate all of the files that we provide, tells you the variables that we use, all of that stuff. So if you are a more experienced data user, I highly suggest checking out our code book and our technical documentation.
Great, and that I think kind of answers, we got a question in the Q&A that I think you kind of answered. Does the site have a data dictionary available? Does the site specify which variables were extracted from which government entities or which different data sources?
Yep, all of that is available in our technical document, again, from that data access page.
Okay, great. I see another question in the chat here. How can the dashboard be of help to congressional districts with no large cities? The population of the whole county is less than 50,000.
That's a great question. So I will say, for our City Health Dashboard website, which is, like I said, only has cities with 50,000 or larger. That being said, we are actively working to reduce that threshold, that population threshold, where we can. And so over the past 2 years, we've had 2 different initiatives where we've had kind of like RFPs, where cities who are smaller than that have applied to join our dashboard for free. All it is like a small application. We do all of the data analysis to put those cities on the site, but that is on an ad hoc kind of application basis. And we just actually announced our 2023 cities that got added. So apologies that you will have to wait. If your city is lower than 50,000, you'll have to wait till next year's challenge opens up. But we are creating more opportunities for smaller cities to get onto the City Health Dashboard. Pivoting to the Congressional District Health Dashboard. So right now we have all 435 congressional districts on that site, total US population coverage. So you'll be able to see more of your kind of community represented on that tool. And coming in June, we are adding census tracts to the CD or the Congressional District Health Dashboard. So you'll not only be able to see all 435 districts, but you'll see the census tracts within those districts. So if that is more meaningful or resonates more with your county or with the population that you serve, you'll also be able to see much more granular data on the congressional district site.
Great. And then I don't see any other questions, but I wanted to take this opportunity, maybe Samantha, if you want to chat a little bit about the Capstone Challenge projects that you have available, where, I can give a brief background about what the Capstone Challenge is, but it's a National League of Cities program that matches up our partners with cities to do kind of pro bono short-term projects together. And so NYU and the City Health Dashboard has applied to do 2 projects, and the application is open right now for cities. So it's actually open through April 28th. So deadline is coming up, but you as a city can look at the full application, and I'll drop the link in the chat in a minute. Oh, great. Callie's already on it. Thank you. You can see all the projects that are available, and 2 of them are from City Health Dashboard. But if you want to participate in those, please apply by April 28th, and there's no cost to the city. And you can, one of them is, I'll let Samantha tell a little bit more, but one of them is about you'll be able to help create a new metric on the site. And then another one is about redlining and understanding how that impacts health in your community. So Sammy, I'll let you share a little bit more detail about those.
Great, thanks. And we're super excited for the Capstone Challenge. So our 2 projects are, so the first one is related to redlining. I'm sure most of the people on this call, if not all of them, know about, the historic redlining that occurred in cities, kind of starting in the 1930s. And even though it was formally ended in the 40s or 50s, cities to this day are still feeling the impacts of redlining. And the communities that were redlined back in the 30s are in most cases, the exact same communities that are still struggling with access to resources, access to financial support. Poverty is greater in those neighborhoods. Health, those communities are struggling more so with health outcomes. So it's really like the links between redlining and current health and opportunity and well-being today are really, they're clear to the people who know about it, but we wanted to figure out a way to integrate those redlining maps into the City Health Dashboard, but do so in a way that was really, really engage cities to understand and work with cities to understand how they think about redlining, how they think about equity, and how they think about improving equity and improving outcomes for all, demographic groups, for all communities in their city. And so this project would be it would be a real thought partnership with cities on kind of applying the lessons of redlining into our current day policy setting, program implementation, program outreach, and making sure that we are intentional both on the dashboard side, but also as a city in thinking through the different ways we work with communities and the different ways we serve communities, knowing the history that we had. The other challenge proposal that we submitted for the Capstone Challenge is, as Annie mentioned, to work with us and our data team on developing a climate change metric. So right now we have on the dashboard 2 climate-related, environment-related metrics focused on air pollution. But as extreme weather becomes more common, as temperatures continue to rise, communities and cities are going to need more data, more information that they can use to figure out how to improve sustainability and improve sustainability equitably, so the communities that are most at risk get the support that they need. And so this would be working with our team to figure out, what sort of climate measures would be of value to your city. Is it land surface temperature? Is it access to green space? So that would be a close partnership to figure out, okay, what are the priorities in terms of climate change and environmental sustainability for your city, and how can we provide that data to you in a way that is meaningful, is useful for your government, for the people that you serve. So those are the two ideas that we have. They're quite different, but we're really excited for both of them. And we encourage anyone to apply.
Yeah, it's a great opportunity to really work directly with the dashboard team, with their data analysts, and to be able to influence the future of the data that's available to all cities and all congressional districts. So like I said, April 28th is the deadline. You do have to fill out an application and get a letter of support from your mayor or from the chief executive of your city. So just flagging that, because I know that can take some time. I don't see any other questions, but let me just pause for a minute, see if there's anything else here. I see a question in the Q&A. Are the research reports on the City Health Dashboard website from your project directly, or is it mostly a clearinghouse?
Not a clearinghouse at all. Those are reports that either our team has done the research for, their manuscripts developed by our team, or so that site has a couple different resources on it. So like I said, manuscripts that are published in academic journals, medical journals, what have you. They're also we have reports that we've developed. So we had back in 2019, we developed a report that looked at small and mid-sized cities and kind of broke out over 700 small and mid-sized cities into 10 different typologies. And we kind of looked at health and well-being and created a report on that. So those sorts of resources would be on that page. And then we also have data insights, which are kind of less analytic than a full manuscript, but more analysis than what you would find in a blog. And so we have a few data sites in there as well. So not a clearinghouse.
Great. Well, Samantha, anything else you want to add before we wrap up here?
No, that's it. I will drop my email in the chat. I am happy to chat and to talk with anyone to walk them through their data on either site, either city's site or the congressional district site. We do webinars like this all of the time. So if you are interested in having it be more kind of curated to your city or your community, please reach out to me. I would love to hear from you. And yeah, just please reach out and explore your data and let us know how you like it.
Awesome. Thank you so much, Samantha, Callie, the whole NYU team, for putting together this presentation and for the incredible work that you're doing, helping our cities understand the health context in their communities and advocate, to their states and to their congressional representatives to improve health in their communities. So absolutely reach out to Samantha. I'll put my chat in here as well, or my email in here as well. Please feel free to reach out to me and I'm happy to connect you also. But thank you everyone for spending a little bit of time this afternoon with us. And I hope you have a wonderful rest of your day. Bye-bye.